All right, welcome back, everyone, to the 21st Century Man podcast. We are diving deep today, and I mean deep, into something that, well, frankly, we often take for granted.
You got that right.
We're talking about our feet. We're cracking open chapter 27 of the 21st Century Man, aptly titled Foot Health. This is your guide, your cheat sheet to understanding why your feet are so much more than just, things at the end of your legs.
Absolutely. And how taking good care of them can, well, impact your health, your comfort, your mobility, everything, really.
This chapter is penned by Dr. Jonathan Steinberg, a doctor of podiatric medicine. And right off the bat, he hits us with this gem from Leonardo da Vinci, who said, "The human foot is a masterpiece of engineering and a work of art."
Couldn't agree more. I mean, think about it, right?
Yeah.
They're incredibly complex structures that bear our entire weight, allow us to move, walk, run, jump, and yet we stuff them into shoes, ignore them, abuse them.
And often only pay attention when they start screaming at us, right?
Exactly.
So today, we're going to unpack the key concepts Dr. Steinberg lays out. From understanding what kind of foot type you've inherited, to recognizing common foot problems, and most importantly, what you can do to keep those feet happy and healthy for, well, the long haul.
It's a plan. Let's do it.
All right, let's start with the basics, the foundation, literally. Dr. Steinberg makes it clear. Your feet, they're not just appendages. They're the base, the bedrock of your entire musculoskeletal system.
It's that classic analogy, right? Think of a house.
Yep.
If the foundation is wonky, if it's not solid, what happens? Everything built on top, the walls, the roof, everything starts to crack and crumble. Same goes for your body.
So we each inherit a certain foot type, and it's either, as Dr. Steinberg puts it, more on the stable side or the unstable side. Now, it's not about having good feet or bad feet, but understanding this inherent stability can be incredibly insightful for us.
For sure. And here's where it gets really interesting. The stability, or lack thereof, in our feet can actually predict, and I mean actually predict, future orthopedic problems.
Yeah.
We're not just talking about foot and ankle issues, but also potential issues in our knees, hips, even our lower back.
Wow, okay, so that's a much bigger deal than many of us probably realize.
It is, and this instability usually shows up as too much movement, or what we call excessive motion, in one of three directions, or planes, as they're called. Picture this, all right? Moving forward and backward, like when you're walking, that's the sagittal plane. Then we have side-to-side movement, like when you're doing those side shuffles at the gym, that's the transverse plane. And finally, up and down motion, like when you're, jumping rope, that's the frontal plane. Too much movement in any of these planes when you're walking, running, just doing your thing can start a whole cascade of problems.
Okay, I'm starting to see how all of this connects. So what's
Yeah.
actually happening inside the foot when we have this excessive motion?
So your foot, as we said, is a marvel of engineering. 26 bones, all working together, held together by a network of ligaments. And then you've got muscles and tendons controlling all the movement.
It's a lot going on down there.
It is. And when you have this excessive motion, it throws off the balance of these muscles and tendons. They have to work harder, and often in ways they're not really designed to work, just to try and keep things stable. And that's when problems start to crop up.
And those problems can manifest in some pretty, well, painful ways, right?
Absolutely. Think bunions, hammertoes, neuromas, which cause this shooting pain in the ball of your foot, and the oh-so-common plantar fasciitis, that stabbing heel pain so many people struggle with. And then you can get painful skin lesions, arthritis in the joints of your feet. It's like a domino effect, starting at the foundation. And it can really impact your quality of life big time.
Okay, so not something to ignore. But the good news, and Dr. Steinberg really emphasizes this, is that many of these biomechanical imbalances, they're not a life sentence you can do something about.
Exactly. And one of the most effective ways to manage them is with orthotics.
Now, for our listeners who may not be familiar, what exactly are orthotics?
Well, think of orthotics like custom supports for your feet that you wear inside your shoes. You can get over-the-counter ones, which offer, basic arch support. Or you can go for custom molded ones made specifically for your unique foot shape.
Like a tailor-made suit for your feet.
Exactly. And their main job is to, realign your foot and ankle to reduce that excessive motion that's causing all the trouble. They help restore a more natural, more efficient way for your foot to move.
So taking some of the strain off those overworked muscles and tendons.
You got it.
Okay, so the big takeaway here is know your feet, understand their natural tendencies, and if there are imbalances, well, orthotics can be a game changer. Now, let's move on to something Dr. Steinberg really stresses: early intervention. Why is it so important for us to catch these foot problems early on?
Because, let's face it, our bodies are amazing healing machines. but they do have their limits. As we get older, our ability to bounce back from injuries is just not what it used to be.
Things just don't heal as quickly.
Right. So a small issue in your foot, something that's relatively easy to fix now, can become a much bigger, much more complicated problem later on.
It's like ignoring a tiny crack in your windshield and then boom, you've got a full-blown spider web.
Exactly. And that's why seeing a board-certified podiatrist early on can make all the difference. They can identify those underlying instabilities, help you prevent complications, slow down the progression of conditions like bunions or arthritis, and even help you avoid those pesky knee and back problems that can stem from, believe it or not, your feet.
So podiatry, not just about treating foot pain, but actually preventing it.
Preventative medicine at its finest. Especially if you're active, an athlete, putting a lot of stress on your feet, seeing a podiatrist regularly should be a non-negotiable.
Okay, great advice. Now let's dive into some specific pain conditions that Dr. Steinberg says really warrant our attention. Let's start with one many of our listeners are probably familiar with. Heel pain, or plantar fasciitis.
Ah, the dreaded plantar fasciitis.
Yep, this is something that can develop quickly, seemingly out of nowhere, right? Whether you're an athlete logging serious miles or just going about your daily routine.
Absolutely. And the culprit is often that excessive flattening of the foot, that front-to-back motion we talked about, the sagittal plane movement.
So remind us, what is the plantar fascia exactly?
It's this thick, strong band of tissue, a ligament, that runs along the bottom of your foot. It connects your heel bone to your toes, and it acts like a shock absorber supporting your arch.
Okay, I'm visualizing it.
Good. Now, when your foot flattens out too much with each step, it puts a lot of stress on this ligament, the plantar fascia. And over time, that repeated stress can lead to inflammation right where it attaches to the heel bone, the calcaneus.
Ouch. And what about those heel spurs you sometimes hear about? Are they the main cause of the pain?
Well, not necessarily. An X-ray might show a heel spur in someone with plantar fasciitis, but the spur itself isn't usually the primary source of the pain. It's more like a result, a consequence of the long-standing inflammation and the plantar fascia pulling on the heel bone.
Ah, okay, so it's a symptom, not the cause.
Exactly. And that's why addressing the excessive flattening, like with orthotics, is so crucial. It reduces the strain on the plantar fascia and helps calm down the inflammation.
Gotcha. Now, another pain point Dr. Steinberg talks about is pain on the inside of the knee joint. You wouldn't immediately think that's connected to your feet, but he explains how it is.
Right, and this is where that foundation analogy really comes into play. So pain on the inside of your knee, it can actually originate from a biomechanical imbalance in your feet, specifically something called excessive pronation.
Pronation. Now, I've heard that term thrown around a lot, but what does it actually mean?
So pronation is the natural inward rolling motion of your foot when it hits the ground. It's normal, it's part of how we walk and run.
Okay, so it's not inherently a bad thing?
Right. But excessive pronation, that's when things get tricky. That means your foot is rolling inward too much and for too long, and it creates this chain reaction that travels all the way up your leg to your knee. This inward roll can actually cause your knee joint to twist slightly, leading to uneven pressure and what Dr. Steinberg calls a dysfunctional glide of the joint surfaces.
So, because the foot's not stable, the knee's not working as smoothly as it should.
Exactly. And then your body, being the amazing machine it is, tries to compensate for this instability. It tries to stabilize things by using muscles in ways they're not really designed to be used. And that can put a lot of stress on the knee joint, eventually damaging the cartilage, not just in your knee, but potentially your hip and even your lower back. It really shows how interconnected our bodies are, you know?
Yeah, a problem in your foot can manifest as pain somewhere completely different. Fascinating. Now, let's shift gears a bit and talk about gout.
Ah, gout. The bane of many a foot.
How does gout typically present, especially in the feet?
Well, it usually announces itself pretty dramatically. Sudden, intense pain, redness, swelling, warmth in the joint, most commonly the big toe, but it can affect other parts of the foot and ankle too. And the culprit, uric acid, too much of it in your blood.
Uric acid, that's a byproduct of our metabolism, right?
It is. And when there's too much of it, it forms these sharp, needle-like crystals in and around the joints. And that, my friend, is what causes all the trouble.
So the crystals themselves are the source of the pain.
They are. And to make matters worse, if you have repeated gout attacks, these uric acid deposits called tophi can actually build up and cause further joint damage.
So who's more prone to gout?
Men, unfortunately, tend to be more susceptible than women. And certain things can increase your risk, like being overweight or obese, having high cholesterol. And lifestyle choices play a role too, like dehydration, alcohol consumption, sugary drinks. Even some medications like diuretics can trigger gout attacks. If you know you have a tendency to produce more uric acid, there are medications like allopurinol that can help manage those levels, along with staying well hydrated.
So a combination of nature and nurture at play. Now, let's talk about something many of us have probably battled at some point. Fungal infections.
Oh, yes. Athlete's foot, nail fungus, the joys of sharing showers and locker rooms.
These are incredibly common, right? And usually caused by, what is it, a type of mold?
Yep, usually a dermatophyte, which is basically a mold that loves warm, moist, dark environments. And what better place than the inside of our shoes, especially if we're prone to sweaty feet?
The perfect breeding ground.
Unfortunately, yes. Now, athlete's foot usually shows up as dry, itchy, flaky skin, often between the toes, that classic telltale sign. Fungal nail infections, though, they make your nails thick, discolored, kind of yellowish or brownish, and sometimes brittle.
And those can be really stubborn to treat.
They can. And some people are just more prone to these fungal infections, and there's some evidence that genetics play a role. For some, their immune system just doesn't recognize these fungi as a threat, so they multiply more easily.
Makes sense. And with nail infections, the fungus can actually get under the nail, making it even harder to reach.
Exactly. It's in the nail bed, the nail root. It's a whole party down there.
Okay, so for athlete's foot, what are our treatment options?
So a podiatrist can diagnose it pretty easily, sometimes by taking a scraping and looking at it under a microscope or doing a culture. Treatment can range from over-the-counter antifungal powders, creams, sprays, to prescription oral medications like terbinafine or Lamisil for more stubborn cases.
And are there any specific over-the-counter products that Dr. Steinberg recommends?
Yeah, he mentions Lochman Ultra, clotrimazole AF. Those are often effective. Ketoconazole 2% cream is another good option. It's got a broader spectrum, works against yeasts like Candida too.
Good to know.
And there are even these cool UV shoe trees like the Steri shoe that can help sanitize your shoes and zap those fungal spores.
Really? So you just pop them in your shoes?
Yep, very nifty, huh?
Definitely. Now, what about applying these antifungal creams? Any tips for our listeners to make sure they're using them effectively?
Absolutely. So first, always wash your feet, dry them thoroughly, especially between the toes, then apply the cream twice a day and keep it up for a full week, even after the infection seems to be gone.
So don't stop prematurely.
Nope. Gotta make sure you really kick those fungi to the curb. And if you don't see any improvement after a week or two, or if things get worse, more redness, swelling, pus, see a doctor right away. It could be a secondary bacterial infection brewing.
Good point. And what about preventing these fungal infections from coming back? Any tips on that front?
Well, the key is to create an environment where fungi just don't want to hang out. So dry your feet thoroughly after showering, swimming, anything that gets them wet. Don't wear the same shoes every day. Let them air out. Use antifungal sprays or powders in your shoes, and even consider applying an antifungal cream once a week as a preventative measure.
Like a weekly spa treatment for your feet.
Exactly. And of course, change your socks daily, more often if you're working out or your feet get sweaty. And avoid going barefoot in public showers, locker rooms. Always wear flip-flops or sandals.
Sound advice. Now, what about those tougher fungal nail infections? Those can be a real pain to get rid of.
They can be. And unfortunately, those over-the-counter creams often don't cut it because they can't really penetrate the nail and get to the fungus underneath. Dr. Steinberg says the most effective ways to truly cure onychomycosis, that's a medical term for fungal nail infection, are either oral medications like terbinafine, which is Lamisil, but that usually requires a 90-day course and can have side effects, or pinpoint laser treatment.
What about laser treatment? Any downsides to that?
Well, it can be a bit pricey, but it's generally painless, according to Dr. Steinberg, and there are no major reported complications.
So worth considering.
Definitely. And sometimes combining laser or oral medication with a topical treatment can yield the best results.
So if you're battling those stubborn fungal nails, talk to your podiatrist. They can help you figure out the best strategy. All right, let's move on to another common culprit of foot problems. Arthritis.
Ah, yes. The wear and tear of life, often showing up in our joints.
So there are different types of arthritis that can affect the feet, right?
Right. You've got osteoarthritis, which is basically the wear and tear type, the kind that develops over time as the cartilage in our joints gradually wears down.
It's like the shock absorbers in a car. They lose their springiness after many miles.
Perfect analogy. And as that cartilage wears away, the bones start rubbing directly against each other, causing pain, stiffness, swelling. You can even get bone spurs growing around the joint, making things even worse.
And what are the typical treatments for osteoarthritis in the feet?
Well, first line is usually pain relief and reducing inflammation. Over-the-counter NSAIDs like ibuprofen can help, or for more targeted relief, your doctor might inject corticosteroids directly into the joint.
What about when those conservative treatments aren't enough?
Then you start looking at surgical options. There are procedures to clean up the joint, remove bone spurs, sometimes even fusing the bones together to eliminate painful motion. And joint replacements are becoming more common, especially for the big toe, and now they're even available for the ankle joint.
So some pretty advanced options out there.
There are. Now, besides osteoarthritis, you also have systemic types of arthritis, like rheumatoid arthritis and psoriatic arthritis. These are autoimmune diseases, meaning your own immune system is attacking your joints.
And those can affect the feet too.
They can, along with other joints in your body. And managing these conditions requires working closely with a rheumatologist to control the underlying inflammation and slow down joint damage.
Makes sense. Now, the chapter also touches on alternative therapies for arthritis,
Yeah.
things like cannabis-based oils, acupuncture, reflexology. What's Dr. Steinberg's take on those?
Well, he acknowledges that some people find relief with these alternative approaches, but he also points out that the scientific evidence supporting their widespread effectiveness for arthritis is still limited.
So more research is needed.
Exactly. And then you have supplements, things like curcumin, omega-3 fatty acids, glucosamine, chondroitin sulfate. They're touted for their anti-inflammatory properties.
Right, but are they really effective?
The jury's still out on that one. Some people swear by them, others don't notice much difference. As with any supplement, it's best to talk to your doctor before you start taking anything.
Always good advice. Now, let's move on to another pesky foot problem. Plantar warts.
Those little viral invaders.
What exactly are they and how do we get them?
They're caused by the human papillomavirus, or HPV, which can infect the skin. You usually need a tiny break in the skin, a little abrasion for the virus to get in, and often your immune system needs to be a bit down for it to take hold.
So where do we typically pick up this virus?
Warm, moist environments are HPV's playground. Think concrete walkways, grassy areas, dirt, especially around pools and locker rooms where there are those rough, non-slip surfaces that can cause those little abrasions.
I see. And do plantar warts always need treatment or can they go away on their own?
About 30% of the time, they do spontaneously disappear.
Oh, okay, so there's hope.
There is. But it can take a while, up to 6 months, and in the meantime, they can be painful, irritating, and let's be honest, not the most aesthetically pleasing things to have on your feet.
So if we do need treatment, what are our options?
Well, there's no magic bullet, unfortunately. The approach depends on the wart, its location, the patient. Dr. Steinberg does recommend treating them when they're small, as they're thought to have a lower viral load then. One common approach is using salicylic acid. You can find over-the-counter treatments with 40% salicylic acid, but higher concentrations are often more effective. You usually have to apply it regularly and debride, which means removing the dead skin to help it penetrate.
So it's a process.
It is. Another option is cryotherapy, where liquid nitrogen is used to freeze the wart. That can be a bit painful, but it's pretty effective.
What about just cutting them out?
That's an option too, surgical excision, but it can be painful and it might leave a scar.
So not always the first choice.
Right. And there are other things a podiatrist might use, like lasers, topical medications like retinoids, 5-fluorouracil, cantharidin, which causes a blister to form.
Sounds like it's best to talk to a podiatrist and see what they recommend.
Definitely. They can tailor the treatment to your specific situation. Okay, let's talk bunions.
Those bony bumps at the base of the big toe. What causes them?
Well, it's basically a misalignment of the joint where the big toe starts to angle inward toward the other toes. Tight shoes, stress on the feet, and some types of arthritis can contribute to their formation.
So those pointy-toed shoes, probably not the best choice.
Definitely not. The main symptoms are that bony bump, pain in the joint, stiffness, and Dr. Steinberg talks about two main categories of bunions. One is caused by fungal biomechanics, basically the way your foot moves, and the other is juvenile bunions, which tend to be more genetic and show up in younger people.
Interesting. And he also mentions positional versus structural bunions. What's the difference there?
So a positional bunion happens when there's extra bone growth on the side of the metatarsal head, that's the long bone connected to your big toe. This bone growth pushes the tendons and the joint capsule out of alignment.
Okay, I'm picturing it.
Now, a structural bunion, that's when the angle between the first and second metatarsals, those long bones in your foot, actually widens. This pushes the big toe even further towards the other toes, and that can cause more serious pain, swelling, and even those painful calluses or sores on the skin.
Ouch. Not good. So how do you treat bunions?
Depends on the severity and the symptoms. If it's mild, changing your shoes to something wider, taking over-the-counter NSAIDs for pain, that might be enough. A podiatrist can also do things like cortisone injections to reduce inflammation or platelet-rich plasma injections.
And if those don't work?
Then surgery might be on the table. There are procedures to rebalance the soft tissues around the joint, remove excess bone. For those structural bunions with the widened angle, they might do an osteotomy where they cut the bone and realign it, often using screws to hold it in place.
Sounds pretty intense.
It can be, but the key takeaway here is that maintaining good biomechanics in your feet and wearing proper shoes, that can go a long way in preventing bunions and slowing down their progression.
So another case for taking good care of your feet. Now, let's talk about hammertoes. Those are the ones where the toes get all curled up, right?
Right. It's a contraction, a bending at one or more of the joints in your lesser toes. They look like little hammers, hence the name.
What causes those to develop?
Often it's an inherited muscle imbalance in the foot, or sometimes the bones in the toes are just naturally a bit longer or shorter than they should be. And this buckling of the toe can lead to the tissues around the joint tightening up, making the deformity more rigid over time.
And what can you do about them?
Well, the good news is that if you catch it early, when the toe is still flexible, a simple tendon release surgery can often fix it. It's a quick recovery, about 2 weeks, and you're back to normal.
And if it's more advanced?
If the toe has become rigid, they usually do an arthroplasty, where they remove a small piece of bone to decompress the joint and straighten the toe. That takes a bit longer to heal, about 4 weeks in a surgical shoe.
Okay, so once again, early intervention is key. Now let's talk about neuromas.
Neuromas, those can be quite painful.
They are. What exactly are they, and what kind of pain do they cause?
Well, a neuroma is basically a thickened, inflamed nerve in your foot. It usually happens between the third and fourth metatarsal heads, those long bones in the middle of your foot. You get this sharp, burning pain in the ball of your foot, often radiating into your toes. The most common type is called Morton's neuroma.
And what causes that nerve to get inflamed?
It's usually irritation. The nerve gets squeezed and rubbed as it passes under a ligament called the intermetatarsal ligament. Over time, that can lead to fibrosis. Basically, the tissue around the nerve thickens.
What can you do if you think you might have a neuroma?
First, try some simple things. Wear wider shoes to reduce pressure on the nerve. Take over-the-counter NSAIDs like ibuprofen or naproxen for pain and inflammation. You can also try those metatarsal pads, they go in your shoes, and help lift and separate the metatarsal heads, taking pressure off the nerve.
And when should you see a doctor?
It's always a good idea to get checked out to rule out other things, like a stress fracture. A podiatrist can usually diagnose a neuroma based on your symptoms and a physical exam.
What about treatment?
They might start with cortisone injections. Those can reduce inflammation, along with NSAIDs and those metatarsal pads. If that does the trick, great. But if it doesn't, they might recommend surgery.
What kind of surgery?
The most common one is a neurectomy, where they remove the thickened part of the nerve. You might have some minor numbness in the area afterwards, but the pain should be gone.
So taking pressure off that nerve is the key. Now let's talk about ankle sprains. Everyone's probably rolled their ankle at some point, right?
Happens all the time.
So what exactly happens when you sprain your ankle?
It's basically when the ligaments supporting your ankle joint get stretched or torn, usually from a sudden twisting or rolling motion.
And ligaments, those are the tough bands of tissue that connect bones, right?
Exactly. Now, the most common type is an inversion sprain. That's when your ankle rolls inward, and it can stretch or tear the ligaments on the outer side of your ankle. You might get bruising, swelling, and of course, pain, depending on how badly the ligaments are damaged.
What should you do if you sprain your ankle?
The first thing is RICE, rest, ice compression elevation. That helps control the swelling and pain.
Good old rice.
Yep, it's a classic for a reason. And if you think it might be a fracture, get to a doctor right away. For those moderate to severe sprains where the ligaments are really stretched or torn, an ankle brace can be really helpful.
What kind of brace?
Those air cast style ones are good. They immobilize the joint a bit and help those ligaments heal properly without getting stretched out further.
So giving them the support they need to recover. Now, Dr. Steinberg also talks about preventing foot and ankle injuries. What are some key tips he offers?
He's big on warming up properly before any activity and cooling down afterwards. Don't jump into strenuous exercise without prepping your muscles. And gradually increase the intensity and duration of your workouts. Don't overdo it.
Makes sense.
If you're into sports, proper technique and gear are crucial. And cross-training, that's important too. Vary your activities, don't do the same thing every day.
So giving your body a chance to recover.
Exactly. And don't ignore pain. If something hurts, rest, figure out what's going on, don't push through it.
Good advice. Now, there's a section in the chapter specifically for people with diabetes, and it highlights how crucial foot care is for them.
It's absolutely vital. Diabetes can wreak havoc on your feet in a few different ways.
How so?
Well, first, it can damage the blood vessels, leading to poor circulation. That means wounds heal more slowly, and infections can become serious more easily.
Okay, that's scary.
It is. Then you have neuropathy, which is nerve damage. It can cause numbness, tingling, pain, and you might not even feel a cut or a blister, which can then get infected.
So you might not even realize you have a problem.
Right. And then there's the immune system. It's not as effective at fighting infections in people with diabetes.
So any little nick or cut can become a big deal.
Exactly. That's why Dr. Steinberg stresses the importance of daily foot inspections for anyone with diabetes. Look for cuts, blisters, red spots, swelling, anything unusual.
And if you see something, don't wait to get it checked out.
Absolutely not. Early intervention is key. And meticulous foot hygiene is crucial too. Wash your feet daily with mild soap and warm water. Dry them thoroughly, especially between the toes. Wear good shoes that fit well and don't rub.
So no cramming your feet into those stylish but ill-fitting shoes.
Nope, comfort over fashion in this case. And of course, managing your blood sugar is paramount. That helps protect your nerves and blood vessels.
Right, so all those lifestyle factors we talk about so much on this show, they play a huge role in foot health too.
They do. And regular checkups with a podiatrist, those are a must for anyone with diabetes.
Great advice. Now, as we wrap up our deep dive into this chapter, I wanted to highlight how much Dr. Steinberg praises the 21st century man as a whole.
He does. He really believes it's a valuable resource for men, covering so many important aspects of health and well-being.
And he specifically commends this chapter on foot health, pointing out how often this foundational area is overlooked.
It is. We often neglect our feet until they start giving us trouble.
So true. And he encourages all our listeners to grab a copy of the book and read it cover to cover.
It's a treasure trove of practical advice.
It really is. Well, I hope you all enjoyed this deep dive into Chapter 27 of the 21st Century Man. I know I learned a ton, and I hope you did too.
Me too. It's amazing how much is going on down there in our feet and how crucial they are for our overall health.
So take care of your feet, folks. They're the foundation upon which your entire body stands.
Couldn't have said it better myself.
Well, that's it for today's episode. We're looking forward to exploring another fascinating chapter next time. Chapter 28, Hand Health. We'll delve into all things related to those amazing tools we use every day. Until then, take care of yourselves, and we'll see you back here soon.